Hey everybody, Reagan Archibald here, founder of East West Health, and I want to talk to you about this concept called a target when it comes to your health. One of my mentors, he said, if you don't have a target, you'll miss every time. And so when it comes to your health, people come to me when they say, Reagan, my cartilage is gone on my knees, I've got bone on bone, I'm in pain, or my shoulders are achy all the time, or I've got autoimmune diseases and I'm tired of being on the medication. Other patients come and they say, look, I'm pretty darn healthy, but I want to optimize my health. I feel like I'm kind of waning in my 50s or 60s. My endurance isn't where I want it to be. And so what I want to share with you in this short video is I want to share with you a brand new framework of medicine that actually is designed around improving your health, not only ending pain and chronic disease, but also getting your health optimized. And so the first step you want to look at is, what's the target that we're going for? What would you like to feel like? And so some of the results that we see in our clinic is we see patients who have no pain. So that would be one of the things that we're looking for. The other thing is no disease. So you run your labs and everything looks great, not from your doctor's perspective, but from a functional perspective where we see that there's no systems that are out of balance. Health independence, what would that look like to you if you were in your 80s, your 90s, maybe you're 110, and you're not dependent on anybody for your health? Would you enjoy that? Would you appreciate that? Would you say that would be a target? The other thing is, are you educated about your health? Because you can't be health independent but also have no knowledge about how your body works. Because this is the one thing we're in 100% of the time, and I'm shocked at how many people know more about their house, they know more about their car than they do about their body. And so, educated about your health. I want you to love the way you look, love the way you feel. I want you to have freedom of movement where you can squat down, you can hinge, you can pick things up, you can carry things, you can move your body, you can run, you can jog. That's freedom of movement. Freedom of stress. And so freedom of stress, the very first thing we do is a frontal lobotomy, and that eliminates stress for the rest of your life. Okay, no, we don't do that, but freedom of stress is learning how to tolerate the variables that come into our lives and learn how to breathe through it and cope with it. Increase confidence. If you don't have health, it's like that saying that, we all have 1,000 wishes until we lose our health, and then we have one wish, and that is to regain our health. And so I want to increase your confidence in a bigger future because you do have your health. And then finally, better relationships and an enhanced quality of life. So if we made that the target, we'd say, well, how can we get you to that place? Well, I can tell you, drugs and surgery are not going to get you there. Some drugs and some surgery are going to be necessary, but the far majority are not. We're the most heavily operated on population on the planet. We're also the most heavily medicated. We get twice as many surgeries as the next country in the world, and we are almost 3 times the amount of medication. So in order for us to get to your health independence, we have to get you freedom from medications, freedom from drugs, unnecessary brain fog, freedom from aging, freedom from disease, freedom from your thyroid issues, the weight gain, freedom from poor health, from stress, freedom from fatigue, and freedom from confusion when it comes to your health, so that we can create freedom too. And when you look at what you're able to do when you have your health, that's when you're able to move freely, you're able to think clearly, be happy, have relationships, enjoy your life, have fulfilling work. You can hike, bike, and live your life, and then play with your kids and grandkids. And so this is the target that we're going for in our health independence. And so what I found is a lot of clinics out there, not only is the healthcare system designed to keep you sick, but the other thing it's designed to do is to keep you in conformity with your doctor. So your doctor in the past had all the knowledge, and the doctor would transmit that knowledge to you. But what we want to do is we want to use our genius and understand what's going on in your health, but then hand that knowledge off to you and help mentor you and train you along the way. Doctor, historically, if you look at the Latin of the world, the word docere, it means to teach. And so that's what we want to do for you. And so what we found is there's 4 key steps that we take every single patient through at East West Health. Most clinics out there, all they do is they focus on, let's get rid of the symptoms, let's give you either a medication or an herbal supplement to get rid of those medications, and it doesn't get to the root cause. But what we found is if we can get the right tests ordered, we give you the right treatments, And then we take a team approach where there's teamwork and mentoring. So I tell patients 50% of what we do, our treatments, the medicine we practice, is going to get you 50% of the results. The other 50% comes from the energy and the effort you put into your health and your life. How much you care about your health and how much you care about your life is directly proportional to the results you're going to get. And then the fourth thing is we create a sense of ohana, a sense of pono. And what that means is it's a place where you have a sense of belonging, a sense of purpose in, a sense of really feeling and expressing your power, and then a sense of place, a place where you belong. And so East West Health is not a place where you walk in and you feel isolated. It's a place where our patients tell me every single day, Reagan, I feel like I'm part of the family. And so I want you to enjoy that sense of pono that we have here at East West. The next thing we do, we focus on 5 core pillars of health. We focus on your gut health and detoxification. We focus on nutrition. We focus on hormonal health. We focus on fitness and exercise. And then we focus on brain optimization. And so the way we take you through our process is very simple. We have 3 branches of medicine that we practice here at East West. The first branch is regenerative medicine. Now, regenerative medicine is fascinating because this is where we can take things that are damaged and aging and degenerated and make them new again. So we do that with stem cell therapy. We also do it with ozone and peptides. And in the next video, I'll dive deep into what these things are. The other part of regenerative medicine that we use are PRP and trigger point injections. So platelet-rich plasma, trigger point injections, and then there may be some acupuncture, some chiropractic adjustments, and some physical therapy. Finally, we go to traditional Chinese medicine. Now, traditional Chinese medicine is something that I'm trained in and I love, and so acupuncture is one of the Chinese medical modalities. Chinese herbal medicine, one of the modalities. Some of the others that are not as well known are Qigong and Tai Chi, Tui Na, So Tai Ho, and then food and nutrition. And we take you on a deep dive in traditional Chinese medicine. And then finally, we take a functional medicine approach. And what functional medicine is it's an approach where we get the right labs ordered, the right tests that are based on these 5 pillars, and then we address all core 5 pillars of health based on what your labs reveal. So one of the things that happened to me is I grew up on a farm in Idaho, and I was exposed to a lot of Roundup. So my body was covered and soaked in glyphosate. And I realized at a young age, I said, man, all the doctors, when they'd run my labs, they'd say, Reagan, everything looks good. You're just stressed. And I said, there's got to be something more than just the stress. And it wasn't until about 10 years later, I ran my genetics, and I realized, wow, I do not methylate well. I don't process toxins very well at all. And so it put me in a condition where I had Hashimoto's, and I also had what's called psoriasis. So I had to learn to use the technology through testing my genetics to support my body. And now in my 40s, I feel better. I have more energy, more vitality than I had in my 20s. And I want to do the same for you. So that's where 100, we're trying to make 100 the new 60. And so the other thing you need is nutrition, brain health, fitness and exercise, and then sleep and relaxation. And so we found with using these 3 versions of medicine, traditional Chinese medicine, regenerative medicine, and functional medicine, that's where we can really get to the underlying cause of your health concerns and then optimize health on top of that. So I hope you've enjoyed this, and I'm going to do 2 more videos. The next one, I'm going to show you how you can take these versions of medicine and use them in your day-to-day life so you can optimize your ability to live to be 120. So I'll see you in the next video.